Everything is based very carefully on a work of caresses, meaning a very light touch with minimal pressure. It is clearly seen in the images that we try to use the entire palm of the hand, therefore, a surface as broad as we can make it that can help push those fluids. It should always be from bottom to top, thus a push towards the heart and lymphatic areas to help those fluids flow. We must try to never cause pain, therefore if we feel any painful sensation while working with our hands, we need to lower our pressure even more, which should be low from the start. In this case, for example, Valerio has placed his hands on top of each other, but if our patient feels discomfort, then we may need to revert to a softer technique. We have overlapped our hands, not to increase pressure, but to enlarge the area of action, because with one hand we guarantee a specific area. With two, we double that area. We can apply pressure if we have a larger area to drain, allowing us to cover everything. These images are quite clear. In these cases, we use oil, though it might be somewhat excessive. In this case, using oil and cream can be a bit more helpful because we don't need that high sensitivity unlike other treatments, but we require a lot of freedom to move. The hand should glide very smoothly and not cause irritation because we perform a series of repeated movements for about 30 minutes. Because after all, a lymphatic drainage massage is quite a lengthy application, and this aspect should not be underestimated because a drainage of a few minutes has no effect. So, take all the time necessary to do a thorough job. Therefore, using oil and cream, I'm not saying in abundance, but certainly more than other types of treatments, because it guarantees us a better result. In this case, we can properly use the force of gravity. Therefore, we lift the limb to push from bottom to top. We create an incline that will certainly help reduce recovery times. So let's say that this force of gravity helps us decrease recovery times. We can say in two ways that it facilitates the drainage massage. And let's say it speeds up the flow a bit this way, precisely due to a physical concept. Moreover, it's our hands' work that provides an additional push to this movement. We definitely shorten the time needed. This is certainly valid for every muscle group. Therefore, both the quadriceps, the calf, and the flexor muscles. Always use light movements. Try to cover as much surface as you can. Drain towards the heart and try to take advantage of the slope by elevating a limb or by using wedges, pillows, or our body, therefore supporting them directly on us. By using all these techniques, these little tricks to achieve a satisfactory result. So, does lymphatic drainage massage in this area have special characteristics? Let's say the technique is the same. In the calf, we may need a few more little tricks. Why? The path this fluid must take is a bit longer, because from the calf, it needs to rise as the most distal part of our body in two ways, and getting all these fluids to flow can be somewhat more challenging. It can get a bit more stagnant. We can say the technique remains the same. In the calf, we might need some extra little tricks, because the route this fluid takes is somewhat more long. Because from the calf it must ascend as the most distal part of our body in two ways, and getting all these fluids to flow can be a bit more challenging for sure. However, by always using this technique and ensuring adequate time to exploit it, as we will see later in the video. And also using an incline, a slope that allows us to give an additional boost will help us. Now, as you can see, there is a partial incline. We can always drain because we have a current that flows through the entire calf to the popliteal fossa. If we have a cushion here, something to place under the ankle, we use it. Otherwise, we rest it on our leg, just as you see. In two ways, we can ensure this incline if we want to be more incisive. We take it straight up, as we will see later in the video. In this way, we can also encircle the calf with both hands like a ring and apply an even more aggressive push. What we are seeing can be done in a slightly more advanced state when the pain is somewhat reduced, and we can embrace with both hands and slide them. In general, doing less than half an hour is not advisable. Look, this is the technique Valerio explained earlier. He has practically overlapped his hands. He has bent the knee at 90 degrees and is performing this drainage this way. Now you are alternating them. Yes, then you can embrace with both hands and do work on a larger surface like we did with the quadriceps. Only that the calf, being a smaller muscle, sometimes too much wrapping can cause painful symptoms. We should not create pain in this case. This is important in this technique. We should not generate a painful symptom as it might be normal. For example, in the case of a decontracting massage. Let's say the application is indifferent, in the sense that we use the same technique with the same intensity, with the same methodology. The only real variable we have for the flexor muscles, unlike the others, is that in this position we cannot guarantee a vertical alignment. It's always about stroking, so stroking always with slow movements, light movements that cover the full area and always go from bottom to top. This is, we might say, the key approach in a draining massage. Now we are seeing a gentle stroke over the tibial malleolus. While in muscle work, you do cyclical movements with a large surface, always from bottom to top. Here we must conform to the joint's design on both sides, as you see on both malleoli. Since it is a small joint, we can do this. We can apply a general pressure, surrounding the whole ankle and always draining from bottom to top, while working very, very long on both malleoli. Is the pressure higher compared to other areas? No. It might feel like more pressure due to the very thin skin layer. Thus, it can give that impression. In reality, the pressure is the same as what we have used previously. A soft touch, something very delicate. We also attempt to use, in this case, the force of gravity, so we try to use it in our favor, not against us, as it would unfortunately occur with someone standing. In this way, we tilt the leg and work more meticulously compared to a large muscle group. We need to work on the whole joint, including both the inner and outer sections. And can this type of drainage also be useful in cases of distortion, that is, indirect trauma? Absolutely yes. The concept is the same. In any case, there is fluid that has infiltrated the joint, which may be distorting in nature. Also in this case, always below the pain threshold. We must eliminate all that excess extravasation that has been generated, and we do it bilaterally. Okay, when we say bilaterally, do we treat both the inner and outer parts of the same ankle? Yes, both sides of the ankle. Here we see a different setup because Valerio is showing us essentially the same techniques from this position that promotes drainage. When we utilize perpendicularity, meaning we position the limb vertically, we can surely drive this fluid out more quickly and efficiently. Thus, we encase the entire joint with both hands and always do this drainage very gently. If we have a lot of fluid, that is, if we notice excessive presence, we can extend the drainage all the way to the calf, attempting to carry it as far as we can. Thus, we do not stop a few centimeters from the malleoli but continue to the popliteal area, which is also relevant for massage that is more centered on the calf. This same concept can be applied to the ankle, taking advantage of the entire calf. Direct traumas can occur in nearly every part of the body, so the principles we've shared, the techniques, but most importantly the reasoning, can be applied in every area. Very well, this was our video on manual lymphatic drainage. If you like this video, be sure to like it, comment below, and subscribe to the channel. If you want to take a look at our courses, check the link in the description. See you in the next video.